Well, skipping your morning coffee, sleeping with the wrong pillow or just doing a hard workout, you might be surprised with some of the reasons you can end up with a headache. Here to explain more is Dr Joe Kostorich. Hi, Dr Joe.
Good afternoon, Tracy.
Is it true certain foods can trigger headaches?
Yes, they can, and it's different for different people, so it's not like there's absolutely one food that'll do it for everybody. Cold foods and what's called ice cream headache can come about with people if they're eating very, very cold foods. Now, it's a little bit unfortunate for people if they like ice cream and that happens. Alcohol, particularly the next morning, I think that's an obvious one. Some additives, and in particular MSG, is a trigger for some people. And then there really is a grab bag of different foods, some salamis, some meats, some cheeses, and it's not that necessarily the foods are the problem, but for certain people those foods may trigger a headache. For some people, if they miss their morning coffee, they can find they get a headache, and the reason for that is caffeine can actually help with headaches. So it's finding out what works for you and avoiding that which consistently seems to trigger headaches in you.
I do enjoy my morning coffee, so that's good news indeed. All right, what's the difference between a headache and migraine?
Yeah. A migraine is a form of headache, and it's a particular type. There tends to be a genetic tendency. It's a bit more common in women than in men. It's usually on one side of the head. It can be preceded by what we call an aura, so people might see some flashing lights or stars. Often there's vomiting with it, and it's quite severe. Now, most migraines are severe. Not all severe headaches are migraine headaches, so I think that's a very important point. That people sometimes think because it's severe it must be a migraine. No, not necessarily. So, yeah, migraine is a particular type of headache.
Okay. Are there any tricks to try and avoid an achy head?
Some very useful things. You mentioned in the intro about pillows. So getting a good night's sleep, having a comfortable pillow, making sure you're drinking enough water. We know if people are even a little bit dehydrated that they're more prone to headaches. Obviously, avoiding those things which are specific triggers or factors for you. Try to manage your stress. If you're sitting at a desk and your posture can be an issue and you're getting neck strain, then treating that and having a comfortable pillow.
Can headaches be a sign of something more serious?
The short answer is yes, although almost everybody will get headaches at some point in their life. Now, yes, a headache can obviously be pointed to a brain tumour, but that is very, very rare. Obviously, strokes can start with headaches. Again, be a whole lot of other symptoms as well, and more severe infections like meningitis, you can also get headaches. So a headache in isolation, usually not a problem. You've got to look at the other symptoms as well. So short answer, yes, but vast majority of headaches can be treated on their merits.
Just keep an eye on it if it keeps going. All right, Dr Joe, thank you so much for your time.
You're very welcome, Tracy.